Okay. Good morning, everyone. Thank you for joining us for the 2021 SHIP SMP Volunteer Webinar Series. I want to start this morning by thanking you all for continuing to be a part of Tennessee SHIP and serving the Medicare beneficiaries of Tennessee. I wanted to go ahead and introduce myself. My name is Alain Kakasumu, and I'm the Tennessee SHIP State Volunteer Coordinator. I started in this role back in June, and I've been working with Ryan and Lori up in the TCAT office in Nashville, learning the ropes and getting a better grasp on our program. Just want to remind everyone to go ahead and put yourself on mute before we get started today and to type your name in the chat box. That way we can just make sure we have you down on our attendance sheet. Today we're going to be going over the cost tip sheet. The Medicare cost tip sheet serves as a resource for SHIP volunteers and staff to have a reference of Part A, B, D, and subsidy details and costs. This document is not complete. We are currently waiting for the 2021 federal poverty levels to be announced by Social Security. So our first section today will be covering the costs associated with Medicare Part A. This is the hospital portion of Medicare and includes inpatient hospital stays, skilled nursing facilities, and some in-home care services. So premiums for Part A are determined by quarters of employment. So those who have 40 quarters or more of Medicare covered employment will have Part A benefits with no premium costs. These quarters are typically 40 quarters equates to about 10 years of Medicare covered employment, which means paying into your FICA taxes. And most adults that have worked in the United States for over 10 years will be able to access Part A premium free. However, oopsies. For those with 30 to 39 quarters of Medicare covered employment, they will have a monthly Part A premium of $259. And those with less than 30 quarters of Medicare covered employment will have a monthly Part A premium of $471. Inpatient care services are provided under Part A benefits, and costs are determined by benefit period. The benefit period begins when a patient is first admitted and ends 60 days after they stop receiving inpatient care. As a reminder, there is no limit on benefit periods. So, for example, a beneficiary goes into the hospital today. They have a 60-day stay. Their benefit period won't end for another 60 days after they're discharged from the hospital. So in this case, their entire benefit period would be 120 days. Say another beneficiary goes into the hospital for 10 days. Past that 10 days, on the 10th day they get discharged, you have to wait another 60 days, and then the benefit period will be over. So it's just whatever amount of time they're spent in the hospital plus another 60 days, and that's the benefit period. So for the first 60 days of an inpatient hospital stay, the beneficiary is responsible for Part A deductible of $1,484. For days 61 through 90, they are responsible for a daily coinsurance charge of $371. And for days 91 through 150, they're responsible for a $742 per day coinsurance. Once you go over 90 days of a hospital stay, then you start dipping into your lifetime reserve day, in which there are 60. So, for example, someone could stay in the hospital for up to 150 days. Their services will be covered by Medicare, excluding any deductible and coinsurance amounts. But they would only have that day 91 to 150, the first round. They wouldn't have those days later. And beyond 150 days, your stay is full cost to the beneficiary. Similarly, with skilled nursing facilities, there is a no coinsurance cost for the beneficiary for the first 20 days per benefit period. However, for days 21 through 100 for each benefit period, there's a daily coinsurance charge of $185.50. If a beneficiary is enrolled in a Medicare Advantage plan, their benefit period may vary. Next up, we have our Medicare Part B coverage. This section will be going over the costs associated with the outpatient medical coverage side of Medicare. The Part B premiums are determined by income levels, and Medicare uses a 2-year look back to determine your premiums. This means that your income from 2019 will determine your Part B premium in 2021. Beneficiaries that are new to Medicare will likely have a higher premium starting off if they worked in the 2 years prior to getting Part B coverage. However, they can reach out to Social Security to see if they could work with and adjust their premiums after the first year. But for majority of Americans, their Medicare Part B premium will be that $148.50 per month. So Medicare for premium costs, they're on a income related monthly adjustment amount schedule. So say, for example, in a dream world, I make $200,000 in a year and I'm single. My Medicare, if I was making that amount in 2019, my monthly Medicare Part B premium would be $475.20. Say a couple makes $200,000 a year and they filed together back in 2019. Each of their monthly premiums would be $207.90. However, I would say probably 95% of the time, most of our beneficiaries are going to be reaching that standard premium rate at $148.50. However, it can go up to $504.90 per month. Our third section today will be covering the costs associated with Medicare Part B prescription drug coverage. So Medicare Part B uses a very similar income-related monthly adjustment amount, also referred to as IRMA. However, the way this price is set up is a little bit different. Part D adds a standard amount to the monthly premium instead of just raising the monthly premium across the board. So, for example, go back to my early example of me making $200,000 as an individual back in 2019. I would have, and say I wanted to sign up for a Part D plan and it was a $20 a month premium. Since I would be a part of this fourth tier, I would have to add an additional $70.70 to my monthly premium, which would bring my Medicare Part D premium to an effective cost of $90.70 per month. Likewise, with my couple example from earlier, a couple making $200,000 back in 2019 would fall under tier 2. If they each signed up for a $20 plan, you would add this $31.80 to their plan total, making their effective monthly Part D premium cost $51.80. Lastly, we'll be going over our Medicare savings programs and low-income subsidies. Just want to put another reminder out there before we get into this section that we are still waiting on our 2021 information to come in for us to finalize this information. Just to go over our Medicare savings programs, there are 3 that we deal with most often. They are QMB, SLMB, and QI1. And I just wanted to put out a reminder that these services are provided through our state Medicaid program, TennCare. So first off, we have qualified Medicare beneficiary. Sorry about that. Qualified Medicare beneficiary. This one assists with Part A and Part B premiums, as well as Part B deductibles, co-insurances, and co-payments. The income limit for this is 100% of that federal poverty level. The next up, we have SLMB, so the Specified Low-Income Medicare Beneficiary. This assists with Part B premiums, and the income limit for this program is 120% of the federal poverty level. Lastly, we have the Qualified Individual 1 or QI1. This also assists with Part B premiums, but the income limit is a bit higher at 135% of the federal poverty level. These are all programs through TennCare, and you as a shift counselor or volunteer can help people sign up for these programs and also screen them for eligibility. Next up, we have Extra Help program. Extra Help is provided through Social Security. Extra Help provides assistance with Part B premium and drug costs. And the income limit for that is 150% of the federal poverty level. I will go ahead and put out there that if you qualify for any of these previously mentioned Medicare savings programs, you will also qualify for extra help. And the application for that is also something a SHIP counselor can help you through. So here we're just going back over these levels for our Medicare savings programs. So these are based off of our 2020 numbers. As a reminder, our 2021 federal poverty line numbers have not been released yet. So say I was an individual making $1,000 a month back in 2020. I would be eligible for a QMB, just making sure I meet those resource limits as well. Resources include up to $1,500 per person for burial costs, so that'd be in a separate burial account. However, the resource limits for QMB, SLMB, and QI1 are all similar, whereas the income limits just go up just a teeny bit per level. For the extra help program, that one is the most generous, and your resources can be much higher, as well as your income limits are going to be a little bit higher than the other two programs. So lastly, go over the Part D subsidies. So depending on your income level, it goes over the amount of subsidy that you're eligible for. So those who are up to 135% of the federal poverty level, they're eligible for 100% subsidy of their Part D premium costs. So in 2020, Extra Help program would help supplement $32.74 towards your Part B premium. And depending on your income level, it'll go down with your, the amount of subsidy will go down incrementally. Yeah. And that is the end of the presentation today. Please let me know if you have any questions, and I'd be happy to answer them.